And I was like, why doesn't this happen in medicine? Why doesn't it happen in rehab? And there's maybe a select number of individuals, but why doesn't it happen as a normal process? And that was Hi, everyone. Welcome back to the podcast. For all you new listeners, welcome to the podcast. All of you who've listened to my stuff in the past, welcome back. For those of you who are watching on my YouTube channel and are watching the video portion of this, I am coming from the new sports performance location. It looks a little bare at the moment just because we haven't had we haven't been able to move in. But the great news is that we've been making a lot of progress. So I wanted to share this episode because I'm a big believer in like energy and positive thinking, and so I'm in this new open space, and a lot of progress has been made today. So before I go into the podcast, I always like to just touch base on like what's happening in my life and all the good things. So overall's good. I've been with the family over the weekend, and we took a little trip, and it was just good to get away, just have the family just kind of regroup. There's been a lot for those of you listening to my podcast in the past. There's been a lot of really cool updates right now with sports performance, and we're just crushing it. We're just like behind the scenes trying to do everything we can to get this new facility up and running. And for those of you interested, it's a journey. It's a lot of work, and I'm enjoying every minute of it. But the time away was good. We just kind of got to reset. But that's good in my life. Just kind of mental clarity and progress with new location, with the team, refocusing on myself as a leader, as a person, as a husband, as a father, as a coach, as a mentor. So I'm coming back refreshed and ready to rock and roll and share with you a topic that I didn't know was going to stir the pot. I thought this was a topic that everyone did, or that a lot more people uh, were doing this regularly. And let me tell you the background of the story of the reason why I'm doing this podcast. So, oftentimes I'll tell my team, I think you should have a plan A, B, and C. And anybody who enters our world questions, what does that entail? And as people progress through our kind of training and methodology, I explain that it's one of the greatest things I've ever learned from technical coaches. So sprint coaches, throwing coaches, soccer coaches, doesn't matter. It's just the mindset that they have. And when we talk about strength coaches, it's the same. And I just use those principles and use it for rehab. And so I made a post on this on Instagram. If you don't follow me on Instagram, do that like literally right now. Pause this. Chris Garcia, DPT. And I brought it up and I say, I use this at framework with my team, and a couple people said like, well, what does it look like? Can you go through the workflow? What specifically do you do? So I wanted to share that with you because I think it's a fundamental thing that has brought me a lot of success. And if you ask any of my athletes, they love that aspect of it, that I'm always prepared. Like I have something, like even if it goes horribly wrong, I still have something to push them towards or work from or give them something to work on. So let me tell you why this is important. All right, so I used to work in professional athletes for many years, in professional athletics, excuse me, for many years. And that taught me a lot. And it humbled me more than anything else. It actually showed me that I didn't know anything at all. And from all if any of my athletes are listening to this right now, I'm a very different person than I was then. And only because I started to listen more than ever. And I would get frustrated when my athletes wouldn't get better at the speed that I wanted to, or the rate that I saw other people doing. And it got me frustrated because I'm a perfectionist, I'm an OCD, I want to be the best on the planet at whatever it is that I want to do. And it's just who I am. And actually, I think all of you guys who are listening are just like that. And I would see athletes and I would set up this whole framework, corrective exercise, build out this beautiful Google sheet. And at the time it was only Excel. So Excel sheet, and I would have like week 1, week 7, week 10, everything mapped out, right? And I'd spend hours on the weekends and nights creating perfect templates. And then they would come in saying, none of it worked. Or I'm actually worse now. And my templates were built off of progress. And so I would literally look stumped, which is the worst thing you can do in front of a patient or a client. It's like a surgeon saying, so do you need surgery? And they're just looking at you like deer in the headlights. that doesn't give them confidence. So I had athletes who would be like, I'm worse or no difference. And I was like, wait, what? How is that possible? I planned for this, but what I didn't have is the risk mitigation behind that. I didn't have a plan B or a plan C. So all that looked like was I didn't know what I was doing. And that frustrated me. And the first time I got stumped, I didn't like that. And it usually happens at the worst time when I have a high caliber athlete right in front of me who wants to know answers and wants trust. So I've lost trust with athletes, and I don't like that feeling. I don't think anybody does. And to me, it was more of I know I can do better than this. I'm a better physical therapist. I'm a better human. And why didn't I plan? But I think as you grow into your profession, your professional career, you start seeing things more often and then you can better identify. But what I'm telling you right now, whether you're a new grad or an established PT, you're a veteran, whatever you do, or if you're a PT student, you are ahead of the game. If PT students right now are listening to my podcast, I promise you, you'll be ahead of the game only because the framework to help you do something different, just do it differently. Don't do it like every other person in your office, all the PTs that you see. If you can do this one principle, this will help you massively. So, plan A, B, and C. So, what does that look like? It's nothing too magical, but I do want to share it. So, whenever I map out progressions, and we'll go over a case at Sports Performance every Tuesday, we'll go over a case, a topic, whatever it is. And so usually, this most recent one was my back pain. If you listen to my last two podcasts, it was my back pain. I'm 95% better. So I'll map out back pain or hip impingement. There we go. Let's do hip impingement. I have a ballet dancer, hip impingement, 14 years old, elite. They practice 4 to 6 hours a day, and now they have pain when they bring their foot. You know those ballet moves with just like where their thigh hits their ear, like they're like up in the air. That's when it hurts, or it's like sustained positions and it's rotated inward or external rotation, and that's when they get the pinching. So we'll talk about like, well, what do you think a normal timeline would be? In an ideal world, build your perfect plan. Well, if they have a competition in 8 weeks, you want to have them fully functioning at least by 6 so they can have a full week of dance practice, test it, see how it goes, and then they have another week to learn the routine and everything else. So in an ideal world would be you're better by 6 weeks, full competition by 8 weeks. Now, does that go along with tissue healing guidelines? And that's where you kind of have to bridge the two. The athlete has a want, and you have a want and a need. They need to be safe, and they want to go back to sports. So somewhere in there, you got to blend that two. And the want is the competition, and the need is truly the soft tissue healing and what it's going to take. And somewhere you got to blend that. So I wanted to share a case, let me give you the framework first, and I'll share one of the most monumental cases I've done, and I'm very, very proud of, and it has given me a better framework to treat people from. So the framework. You build your best case scenario, which in this context for hip pain, you're talking about 6 weeks and then 8 weeks. Okay, what is the worst case scenario? That they can't even get better for their competition, that they still have pain at 8 weeks. Wow, that is a rough scenario. Like if you couldn't get hip pain better in 8 weeks, or 6 weeks and couldn't even get to comp, and now they're still painful at 8 weeks, that I would say that's worst case scenario. So what does that mean for you? What did you do wrong? What would happen? The client doesn't listen, or the athlete or the patient doesn't listen. That could definitely go wrong. Well, what else? That you do the wrong corrective exercises, they continue to practice, you have environmental factors, the psychosocial component of it. Those are all worst case scenarios. So you have to attack each one of those elements to prevent the worst case scenario. Well, what do you have to do on the best case scenario? Plan A, address all of those things, right? And then somewhere in the middle is plan B, where it's a hybrid of meeting them on their needs and their wants. And I explain this to people. Anytime if you are a patient or a client or an athlete of mine and you sit on my table one time, anybody listening to this, you do it one time, you'll understand. I'm going to approach you with, give me your ideal scenario, because I got to know what that is. And you say, well, ASAP. Or why? Well, I just want to start feeling better. Do you have anything coming up? No. Okay, so it's not like super urgent. You just want to get better faster. Okay, but you don't have a timeline. You don't have an event. Yes, I have a marathon in 6 weeks. Okay, so I can't lose conditioning. I have to work backwards. So if you want full conditioning, at least by 5 weeks, you got to be ready at least at 2 or 3 to get back onto it and build your aerobic capacity again. So I only have 2 to 3 weeks to fix you. Okay, that's best case scenario. What's worst case scenario? That I don't get you ready by 6. So if I don't get you better by 2 in an ideal scenario, and I'll get you better by 6, somewhere in the middle, I'm probably going to get you better by 4. That's my plan B. Now, what does that look like from a processes? Somebody asked, well, how do you do that from a processy and a tactical level? Okay, that's a really good. I think this person was an engineer, so they wanted like exact bullet points. So let me show you what that is. All right, I share this with my team, and it is my general framework on how I approach any athlete, and it's the algorithm that I use. So the first thing is, what's the injury? What's the acuity? What's the timeline? What's the competition? What's the urgency? What previous treatment have they had? What are they looking for? Why are they doing this? What their current environmental factors are going to impact healing. So ADLs, their work environment, what's their psychosocial component, what previous treatment, what previous injuries, medical complications, medical surgeries. All of those things go into my equation on how am I going to present this plan to somebody. And once I get that in my algorithm, all that's done on the subjective. By the time they sit down and they go through objective testing, I'm putting that objective testing with their subjective testing. Once I do treatment, now I have objective measures within my hands, my eyes, everything, all the above. I put that together with my objective testing and my subjective report. And once I see them move afterwards and I see what their comparable signs are and how much better or worse they are, that then goes in my factors. So if one person goes through and they say, hey, I have a comp in 6 weeks and it's 4 and I need to get them better by 4, are they motivated? Level of intent, their urgency, 4 weeks, realistic. So any psychosocial factors that I need to be aware of? Nope, they're motivated. What's their environmental factors? They're in law enforcement. They stand all day. That could also influence their healing and swelling or whatever it may be. What do they do for fitness? They do high intensity and a lot of running. That also impacts it. So I got to slow them off of that. And then what other comparable or past medical history or pertinent medical history, previous history of knee surgery, all those things go into being able to map out a plan. And so when I do that, and if they have a positive outcome after I treat them, they're like, oh my gosh, that's 60% better. Whoa, I might be able to move this a little bit faster. Right off the top, you just needed some, neuromuscular stimulation. You just needed some mobilization to open things up. I know that might not last for a week or two, but I know that I can make a good impact. So I might bring them in a few days. Within a week, get a couple sessions in, see their outcomes, and their percentages have to increase. If you know my percentages, they got to hit 90% with ADLs to move them onto the fitness side. So if I have that equation, I know all of those factors, my plan of care is going to be accordingly. So I will map it out. Listen, here's what I found. You will have this urgency, you're motivated, you got this job, you've had a previous meniscectomy. Those are working for you and against you. What I saw today, your movement is pretty good, your ankles are this, hips are this. And then on your testing, I found that hips are not too loose. You really got to work on this. Hamstrings are this. Tibial rotation here. Ankle mobility here. We already got a positive outcome. That's telling me we've got a good chance at this. So best case scenario, plan A, we get this better by 2 weeks. Start interval training, get you in for 2 weeks of some form of cardiovascular exercise and a little bit of plyos. And then at week 5, we start boosting you back in for full throttle training. And at least it gives you some conditioning prior to the 6th week. That's best case scenario. Worst case scenario is that you get no better and we have to get you out of the race. They obviously don't like that, right? So if I present that, like nobody wants that. And here's best case scenario. And I will say, if you don't listen, if you don't have these things, you don't do, your homework, you don't sit down when possible, you're not wearing good shoes, you're not wearing your knee sleeve, whatever it is, you're going to go towards the plan C. You do more of plan A, you're in a good position. Somewhere you might be in that plan B. But just know that I've already thought about that. And you know what that gives them? Confidence. That you've already thought about their scenario so much that you already have risk mitigation. And what that allows them to do is buy into the concept of rehab. And I know that sounds really harsh, but people are skeptical. Social media and the internet has made people more skeptical than ever. And what they need is somebody who has confidence and can look them in the eye and say, listen, I've seen this before, or I haven't, but here's where I've already mapped out. This is best case scenario, worst case scenario. I think we get you here, but you can go either way based on what you do. And what that does is it puts all the onus on them. And I think that's very important for them. And I think that's great because it gives them freedom and independence to manage themselves. And they finally realize that there's no dependency. It's not based on the clinician. It's based on their progress, where the clinician tells them and gives them the roadmap, and is their job to help go through that right path. So to create the framework in your head or on a there's things that we do consistently at Sports Performance. We do whiteboard sessions. So on a map, if you're visual, I have to write things out. I have to see it on a map. And so I would literally grab a piece of paper, grab a whiteboard. What is the best case scenario and what does that look like? Everything from their work environment to their ADLs to their motivation to staying positive to doing their exercises to wearing knee sleeves or anything that you add on, all those elements. That's the best. Now on this side, worst case scenario, they don't show up for treatment, they're not motivated, they're negative, they're pessimistic, they don't do their homework, they don't wear the knee sleeve, they don't sit down at work when possible, they don't listen to any of your advice. And you know what's great is when you map that out for them. Like literally we'll do a whiteboard, we have mini whiteboards, and we'll show them like, here's plan A, here's plan B, where do you want to be? Perfect, I obviously want to be in plan A. So take a picture of that, and that way they can see like, man, I have to stay on this. It's not putting everything on you. And I think as providers, we put a lot of pressure on ourselves. Good for you. I love that. I love that about you, but you don't have to. I think you can help ease that with unloading that and telling them, being honest and genuine to patients, clients, and athletes that it is a two-way street. And that's part of the plan A, B, and C is communicating that. Now, the caveat to this is that you've thought of plan A, B, and C before they see you. If you don't, and you treat like every other PT on this planet, where you just show up to work, didn't even look at your patient, athlete, client list, man, you get what you put into it. Like, you just want to show up to work, that's how your patients and clients are. And I think that's really important for you to understand. Like, let me say this again, because I've heard a lot of PTs complain about this. My patients, my athletes, my clients, they just don't do their homework. They're just not motivated. They don't want to do anything. Do you ever think that they're following your lead? That they are doing what you do? You just show up to work, no planning, no homework, no plan A, no plan B, no plan C. You don't put the time and effort. How are you advancing? Just because you take a CEU course in a new treatment style that you may use 10% of the time doesn't make you a better clinician. It just makes you good at that one treatment or that one philosophy. And I think that what happens is that because you take CEU courses maybe once, maybe twice a year, you feel like you're progressing and you're growing and you're doing everything that you possibly can, which I think is the bare minimum, actually. You're actually doing the minimum requirement to maintain a license. And if you really think about that's fine. You get what you put in. And so when you're not planning for flare-ups or you're not planning what could go right or wrong with your patients and clients, guess what? They're not going to get better because you didn't plan or forecast that. You literally showed up to work, saw your patient or athlete list, and treated them. And you know those days, half of them, man, they're worse. The other half, they're doing okay. And then occasional days, you're like, you're a superstar because they all line up and you're like, they're all 100% better. Good. But that's not going to happen with everyone. And you're just playing a bell curve. You're just playing odds. Now, increase your odds by actually going above and beyond weeknights, weekends. Yes, I understand you got paperwork, but if you're looking to be a rock solid sports clinician who enjoys working with really good athletes, this is what the athletes will look for. And guess what? They're going to seek it out. I always tell any new clinician that I meet or any student that your credentials and the CEUs you take mean nothing to athletes. I've learned this myself. You know who the athletes gravitate towards? The person who is genuine, the person who is motivated, the person who looks at them and says, tell me more. Why did you do that? How did you do that? Tell me about your sport. What does it entail? What are you looking forward to? What's your goal? The one who asks more questions and who is like engaged and wants to learn about them and says, you know what? I don't know anything about that, but I'll learn tonight, and next visit, I'll have an idea of what that is and I'll create a plan for you. You know what that athlete does? Athletes have seen a lot of clinicians in their lifetime. That athlete does an internal like eyebrow raise, like, oh, that's pretty good. I've seen a couple people like you. I'm willing to take a shot. Let me see what you got. And they'll come in, and if you come in, you're like, yeah, we're gonna do this today. Yeah, we'll do that one today. And I know you've had those sessions. You're like, ah, shoot, I didn't know what I was gonna do that time. And you reflect, and you just kind of sit back, and you're like, man, that was a crappy session. And I hope you feel bad. Good for you. But I think the way you reduce those is that you constantly and obsessively plan. And a couple people might say like, Chris, what? It's my weekends, and it's my personal time. Good for you. I don't have an answer for you. You have an answer for you. It's all about what you want to put into your career. Like if you want to just be an average PT, then go for it. Then be an average PT. But you got to face up to that. I want you to look yourself in the mirror and tell yourself that I'm an average PT. I want bare minimum. I don't want to do it. I just want to go to work. I want to go home. Then do that. There's nothing wrong with that. Most people listening to this podcast don't want that. They want something different in their life. That's fine. And there's nothing to say anything wrong with those individuals. I'm just saying if you're looking to create plan A, B, and C, that's why you're listening to this podcast. If you're on my podcast, is you're looking for something different. You're looking for something more, or else you'd have been taking a CEU course to hit your requirements for the year during these 30 minutes or half hour or 45 minutes, whatever it is. So nonetheless, you got to have a plan A, B, and C, but it requires so much planning. And where did I get this idea from? Coaches. Think about this. Let's take a football coach. Okay, let's talk about. I'm just admiring Tom Brady at the moment. I think he's incredible at his game. Think about this. The coaches who coach Tom Brady and individuals like this, right? They see a play, right? They see a number of people on the field, and they say, "Hey, I want you to do this play." And then the defense lines up in a certain fashion. They're like, "Whoa, don't do it. The ball's going this way. Change it. Audible." That's a plan B. And if you ever notice that there's athletes who start or actually playing the game, and then there's like 30 other people on the sideline waiting to get their turn. Why? Because an athlete might get hurt, or they might be having an off day. Guess what? We call that a bench. A bench is a plan B, plan C. So coaches have to have plan Bs and plan Cs. So anytime something happens, they're like, boom, doesn't matter, I was ready. And that requires so much planning. All week, they're just trying to video and look at content to look at what to plan for. And they're obsessing. You ever seen a card of plays on a head coach? It looks like a newspaper. They're just like 800 plays. Guess what? Those are plan B, plan Cs. And as a clinician, you know what you come up with? Nothing. How can you say that you're trying hard because you got a degree and you have the bare minimum CEUs? That doesn't do anything. That's like like you just started the race. You're a starter on the platform. You're a starter on the team. So, knowing that, I took that advice from coaches, and strength coaches the same. If a really good strength coach, what they would say is, hey, I have deadlifts, I have back squats, hip mobility and ankle mobility and core work for today. However, I know I have a couple athletes coming off some injuries. I know their back's not going to feel better for that. So you know what I'm going to do? We're just going to do goblet squats, versions of goblet squats, or hack squat, or whatever it is, so that it takes pressure off their low back. And if they come in feeling great, okay, then try the squat. But they already like, how embarrassing would that be? The athlete's like, hey, my back is hurting. They're like, strength coach is looking at them like, what can we do today? It just doesn't look like you're very competent or confident. And so when the strength coach is like, no problem, I already have this up, the athlete's like, perfect, sounds good. They just trust that person. So you have to have plan A, B, and C. So I got it from technical coaches and strength coaches. Though watching those two individuals, it was like seamless. I'm like, how did you do that? They're like, I mean, I had to map it out. I had to write down all, everything on Google Sheets or templates or whatever it is, so that way I could be ready for the athlete. And I was like, why doesn't this happen in medicine? Why doesn't it happen in rehab? And there's maybe a select number of individuals, but why doesn't it happen as a normal process? And that's why I wanted to share this podcast, because at the principal level, the highest level, is I think we have to have different options so that way when people come in flared up, we know what to do. That's at the highest level. At the lowest level, the tactical side, I said write out a whiteboard with plan A, plan B, and everything in between will probably be a plan C. And so at the high principle level, you have that. You need the idea. At the tactical level, you need to have a whiteboard and maybe map something out where you have different scenarios and show your athlete that, your patient that. And then strategy wise, you right in the middle is, well, what do I say? How do I say it? You know what? You show them the whiteboard or you show them the plan and say, hey, here's what I have. Here's the worst case scenario. I would like you over here. But if you don't, you're going to be right here. How does that sound? But if you don't even know what to write on that whiteboard, that's where you are, and remove the whiteboard, and you have this just dull look on your face like, damn it, I got hit again. I don't know what to do. And that's some of the best mentorship that you can get, is changing the framework of the way you do things. Not what you do, it's how you do it and why. So, and if you've heard my podcast before, I'm a big proponent of, like, I'll teach you technical skills, I'll teach you a grade 5, I'll teach you the great taping job to be perfect at one scenario, but you never know what's going to come at you. And I think that's why plan A, B, and C has to be ready. So I would honestly use this as a mainstay, as a very, very important piece of the way you treat. And guess what? Your outcomes are going to be dramatically better. And now you might say, man, I wrote all this stuff out and my patients and clients didn't even show up that day. Yeah, but guess what? You're better for it. Now you already have those templates. Guess what? They become reusable. And you see enough people, you're like, Chris, I only really need 10 templates. Correct. Why are you spending time at the lowest level trying to learn all these technical skills when you can create templates on like high level stuff, and you're like, you just show the same 10 people like general frameworks and it works. Now, I want to share the case of the athlete. A couple years ago, when I first started just kind of changing my philosophy, this is after pro sports, and I really just wanted to understand what is it that athletes wanted and why. And it was my obsession to continue being this like really good sports PT, and I wanted to have an entire framework that I can manage on my own. I had an athlete who was sent to me by this is before like Instagram was Instagram, and it's 2015. So at the time, I think Instagram was like just photos, not even locations, no videos, and I think, I don't know, 15 hashtags or 10 hashtags, or I don't even know if there was hashtags. Anyways, somebody connects with me and they say, I don't know them. They say, hey, I'm at a Vail. I have an athlete for you. Your name came up in a conversation, and I have an athlete for you. But it's a very unique case, and somebody said that you might be able to manage this, and they need to be in San Diego tomorrow or the next day. I was like, all right, tell me more, because I love these cases. If you know my stuff, I love soft tissue healing guidelines, and I love short timelines because it's crunch time, and I really like the challenge because I think I can do it. So they send over the athlete, or sorry, tell me the case. It's a post-op proximal biceps tendon repair. It was fraying, and they actually cleaned everything up, and it's a young CrossFitter, and they're going for their second to last, or their last CrossFit Games. They're 10 weeks out from, or sorry, 10 weeks out from the actual qualification timeline, and they need to be ready to rock and roll in 8 weeks. And I said, who's the surgeon? And they told me, and I said, do I get to manage this independently? Is there a protocol? And they said, no. I was like, all right, perfect, because then that allows me so much freedom. Now, obviously, I connected with the surgeon, and I communicated everything else, but what I meant by that was I'm not being restrained to like a super conservative protocol where I'm like having to range them for 4 weeks, and then I finally get some, strength, and there's a little wiggle room. I get to play with it. They say, yeah, that's fine, no problem. I say, perfect. All right. So I started the rehab, and the cool part is when you look at 8 weeks and you work backwards, there's a lot that can go wrong. But I had to do best case scenario. In 8 weeks, where would I need to be able to do a handstand walks, snatch, strict press, to be able to press and pull above head at max effort with at least body weight. And so it was going to be January 1st at the 8 week time mark, and they had to make the qualify for the games I think in February. And I only had 8 weeks to get them there, and I don't want to say too much, but ultimately I did it, and it was amazing. And I did it with a lot of help. I don't want to take credit for this. There was a strength coach who helped me out with progressions, and we were working together to get this athlete. And I was managing the rehab, 100% rehab. They were managing anything conditioning that they can do lower body or with modifications to upper body. And what I had to do was blend the two. I had to say, okay, well, if they need to be at handstand push-ups at 8 weeks, what do they need to be doing pressing wise to be able to sustain that? When do I start overhead? When I kind of start overhead with load? When I kind of do isotonic movements? Do I do eccentric first? Do I do concentric? And I had to literally map out 8 weeks of upper body pressing, upper body pulling, horizontal pressing, horizontal pulling, and every CrossFit movement known, and insert that into an 8 week block. That took me hours to create, and it was amazing. And it took me so much time and effort. And what it did was, all right, so I knew that I had to have a green light on horizontal pressing to start push-ups. I knew I had to be able to do a push-up. I have to have the full range. I know I had to start with eccentrics and then work my way into concentrics. I mean, there's just so much I had to do. And that was plan A, like perfect at week 8. And then I had the conversation of, what if we don't even get there by week 8? That's worst case scenario. What would need to happen for them to go to 8 weeks? And I had to build that out. And I was like, oh, somewhere in the middle, there was a pivotal time. It had to be at 4 weeks. We had to have full range, no pain, pain free, so we can start loading at 4 weeks. So at 6 weeks, we can start to do a little bit heavier eccentrics, concentrics. At 8 weeks, to be able to test just weight bearing gymnastics. And they did. And then the great thing, the one caveat to this I would say is this person was really good. They had a good engine. They had really good conditioning. So we didn't need to work on that so much. So that gave me a lot of wiggle room and freedom. Now, managing somebody's surgery rehab in a short timeline forces you to think like this. So there was very pivotal moments in my career that I had to do this, and that was one. And that was in 2015. I'm very grateful for that, the amount of time and energy that I put in that. And I don't even know where I have that Google sheet or the template anymore, but what I do know is the thought process to think like that was the biggest thing I gained from that. And while that's not fun, it's like studying for the boards. Like no one wants to do that, but it was the thing that you needed to get you over the edge to make you successful. And that was the moment that really helped me out. So on post-op cases, I build out templates, I build out weeks of progressions, and that's best case scenario. And then I just kind of build backwards, and I have some bumpers and wiggle rooms on each 2 4 week block where I know that I can push or pull in certain directions if they don't meet the time-based and the criterion-based measures. So the reason why I want to do this podcast is because people wanted not just the principle level, like higher level stuff, like why I do it, but they wanted to know exactly how I map out A, B, and C. Really straightforward, create ideal scenario, create worst scenario, and then somewhere in the middle will be the actual. And the strategy is really it is to show them, to create that process and show them so that they have a choice. But most people don't even try to write it out, and then they can't have that conversation. And that's when you come in ill prepared. And there's a famous saying that I will 100% all advocate for. If it can't happen on paper, it just can't happen in life. Whether that's your finances and your budget, you're like, hey, I want to save more. Great. That's like the thought process. There's no action to that. It's never written down. Like, what does it look like? Go backwards. Well, I want to get this ACL done in 4 weeks, and then I want to get back to soccer at 5 weeks. Is that possible? I don't know. Let's do it together. 5 weeks or 5 months. It's a full go. Is that possible? I don't know. What's happening at 4 weeks? Can they get to multi-directional loading? Ooh, that's tough. That means that they have to do linear and lateral by 3 months. Can they start that? Ooh, they can't start lateral. They might initiate it. Okay, can they start running at 10 weeks? Ooh, depends on the protocol. Can they start light plyos at week 8? That would require that they have good concentric and knee-centric closed chain knee extension, knee flexion. Can you start that at 6 weeks? That means that they have to have a quad, no extension lag and everything else. Well, can you get that at week 4? You just keep going backwards, and then you know what? That's what your criteria is. You got to have a week 4, no quad lag. You got to be able to do 20 single leg step downs, sides off the side and off the front. Then you can start plyos, and then you can start linear running. And if you have 2 weeks of linear running, no pain, you can start lateral. If you have no pain with 2 weeks of lateral, you can start multi-directional. Did you pass all your criterion to hop testing and multi-directional sport testing? Yes, then maybe it might be possible. But if you don't map that out, it's not possible. So most of the things, the actionable things that you can take away from this is that you got to write this out. If you don't write it down, you're just listening to my stuff, and that's fine if that's what you want to do. But at some point, you're going to have to create action on that, and that's where I'm good. That's where I'll push you. And if you ask, hey Chris, can you do this? I don't know. I'm going to work through it with you. I'll do it right there in front of you. I'll do a whiteboard session right there with you, and it helps to kind of navigate that. Like, because I don't know all the cases that people present to me, I just need to write it out because then I can see, is this something I can handle? And that's where, if you ever see me do a whiteboard session, is because literally I need to map it out to see if it's possible. Because if I can do it on paper, oh, of course, then it's possible, but it has to be realistic. So at the tactical level, I explain that. At the high level, you know what I'm looking for, plan A, B, and C. At the strategy level, you got to show them, you got to map it out, but if you don't write it out, not even possible. Well, there you have it. It literally is one of the coolest things I've ever been forced to do, and I'm very appreciative of that. And I hope that somebody, I will if I see you. I might put this out in the world, but if I want to host some courses in this upcoming year, and I need to know what you want to learn, what aspects, acute care, acute management. I doubt it's like corrective exercises because I think there's like 1,000 of those in there. Timelines, post-op rehab into strength progression, strength and conditioning principles, how to integrate the two, how to create mesocycles, microcycles, how to tape, how to do I don't acute care management on the side. I don't know. Send me an email, drchris at drchrisgarcia.com. Let me know. I'm curious. I'm already getting the wheels turning on what I'm hearing and what people genuinely want to know that maybe they're not getting in other courses, or it might not be something that is taught in courses normally. So I want to be able to bring that to you. So send me an email. Let me know. But ultimately, I just want you to change your thought process and the way that you manage people, not the way you treat them. Very different world. Okay. Well, there you have it. I am off to hang out with my family. Great weekend. We've got a house party with friends and family in the backyard. I'm really excited about that. And then it is off to the races on Monday with full throttle renovations. We're hoping to launch the new location. I think we've announced this already, so I'll do that Monday, November 15th. So if you want to be part of that soft opening and you want to come hang out with us and me and my team, let me know. Come hang out, send me an email, and let me know when you want to hang out. I hope you're well. I will see you guys on the next episode. Take care.